As a certified pharmacy technician, I've seen my fair share of opioids be prescribed to the pharmacy. Most of the opioids are prescribed after a big surgery for a patient or a big procedure. But I've also seen opioids be prescribed for something simple like a wisdom teeth extraction. In my mind, I believe that that is out of practice, and something like a wisdom teeth removal could be fixed and prescribed with something like over-the-counter Tylenol and not a heavy painkiller. I've been a certified pharmacy technician for going on about 2.5 years now. Today we're going to be talking about the opioid crisis in America. That has been going on since around the early 1990s. But opioids have been around for a very long time, especially back in the wars for the soldiers. But the crisis really started, like I said, in the 90s. So what are opioids? Opioids are extremely addictive painkillers, and they can come in two forms, which are natural and synthetic. The DEA states that whether a person uses a natural or a synthetic opioid, tolerance develops quickly, which leads to an escalation in use and a risk of overdose. Opioids can be used for pain reliever, cough suppressants, and they can also be used as an anesthetic. So what's classified as an opioid? The DEA has 5 classes of drugs. There's Schedule 1, 2, 3, 4, and 5. Schedule 1 drugs are what we know as illegal drugs, so that would be like LSD, marijuana, meth, coke. And then there's Schedule 2 drugs, which are prescription grade. So the Schedule 2 drugs that we'll be talking about today for the opioids would be Oxycontin, hydrocodone or Vicodin, codeine, and morphine. Another synthetic prescription that is a Schedule 2 drug would be fentanyl. And talking about the illegal opioids, heroin would be a Schedule 1 drug that is another opioid. So you may be asking, where does an opioid come from? So it actually comes from a flower. It comes from the opium poppy. So when the poppy or the flower bud is cut into, there's a white substance that can be oozed out, and that is raw opium. Raw opium contains about 12% of morphine. So going into the chemical base of the opium, so they have alkaloids, which are naturally occurring, and they're usually plant-based compounds that often have physiological effects. That's according to Michael T. Compton, author of The American Opioid Epidemic. We do have natural alkaloids that we use in our daily lives, such as coffee or nicotine, but there's also some like cocaine and marijuana that we see that are also plant-based. So going into the legalities of opioids, according to the United Nations Single Convention on Narcotic Drugs in 1961, legal opium production is allowed, and about 2,000 tons of opium are produced each year to supply the world with raw material needed to make medicinal opioids. So going back to the 1990s is when this epidemic all started. According to the CDC, with increased prescribing of opioids and with overdose deaths involving prescription opioids, that's when the epidemic really started in the 90s. And between 1999 and 2010, the amount of opioid prescriptions prescribed tripled. And in 2012, providers wrote 259 million prescriptions for opioids, and that would be enough to give an opioid prescription to every American adult, according to the CDC in 2014. So the reason for this, you may be asking, is physicians had changed their minds and ideas about pain management, addiction, and there was also a very heavy push from pharmaceutical companies, drug companies, wanting to sell Oxycontin, hydrocodone, and they wanted to push for that for the prescribers. So what are the dangers of an opioid? Obviously, the biggest one would be addiction. According to Johns Hopkins Medicine, opioids can restrict your ability to breathe when taken at a high dose, and then when misused, it can lead to a fatal overdose. Now, each person, it depends on their tolerance and their background, but it differs on how dependent a person can be on an opioid. If you take an opioid, say you broke your leg, and you're taking it for your prescribed dose, you're not misusing it, you probably are not going to become addicted. However, if you're on an opioid for a long-term chronic use, say you have chronic back pain, chronic hip, leg pain, and you're on that, there is a higher chance of you becoming addicted. And the biggest danger, again, would be addiction, and opioid misuse can often be a gateway drug to using heroin. So the reason I bring up heroin is because if we go back to the raw opium from the poppy, so you get the poppy flower, which you cut into, and you get the raw opium. That can be turned into morphine, which is a Schedule II drug that is pharmaceutical grade. And when tampered with, it can then be turned into heroin. So you get the poppy, raw opium, morphine, then you get heroin. So the solutions for an opioid use disorder, or an OUD, they're drugs that can be prescribed to wean you off of the cravings and take away the withdrawal symptoms. And those two would be methadone and buprenorphine. So methadone and buprenorphine, according to Johns Hopkins, activate opioid receptors in the body that suppress the cravings, and they're effective and similar in safety and side effects. There's also another one called naltrexone. Those differ from methadone and buprenorphine. They differ because it doesn't turn on the opioid receptors in the body, but it will block the euphoric effects of the opioids. So what's done to prevent an overdose? When prescribed an opioid, especially at our pharmacy, if someone's on an opioid for a long term, we have to offer what is called Narcan, or the brand name would be naloxone, or I should say the chemical drug name would be naloxone. And that's a nasal spray. You often hear about that in the news, or if you know someone that has had an overdose, the cop would administer Narcan. So like I said, it's a nasal spray, and it essentially goes into the body and reverses the effects of the overdose by flushing out the receptors in the body for the opioids. However, this is not an end-all, save-all for overdoses. Sometimes it is too big of an overdose and the Narcan does not help. So if you do know or you've seen an overdose, you absolutely should call 911. How can we help in the opioid epidemic? So if you're being prescribed an opioid after a surgery or a procedure, you have the right as a patient to ask your physician any questions. So my advice to you would be to ask your physician, should I really be taking these many tablets? Is there anything else that I could take for the pain that's not an opioid, something over the counter? Or ask them what their long-term plan is for your pain management if you're on an opioid for long term. And I would really be honest with your doctor. It's okay to have an opioid, like I said, if you're taking the correct dose and it's going to be for short term, but it's absolutely necessary trying to prevent long-term use and prevent dependence. That's the goal. Taking a few of these steps, such as knowing the history behind the poppy and the opioids and knowing how addictive they are, can help save your lives, and it can help save loved ones. Thank you.